Well, October is Breast Cancer Awareness Month, and here to talk about the latest in breast cancer prevention and treatment is Dr. Kimberly Helseth with the Nebraska Medicine Fred and Pamela Buffett Cancer Center. Dr. Helseth, thank you for joining us today.
Absolutely. It's great to be here.
Yeah, so let's start with, the current guidelines for mammograms. Who should be getting them, and tell us, how effective are they for finding cancer?
Absolutely. Well, according to the National Comprehensive Cancer Network, or NCCN guidelines, we're currently recommending that all women age 40 and older should be getting an annual screening mammogram. Mammograms are incredibly effective, up to 90% able to detect a cancer. Now, there are some women for whom a mammogram may not be sufficient. That tends to be women with denser breast tissue. So I always encourage my patients, make sure you're not just looking at the report to see if there's cancer or not. Make sure you're aware of what your own breast density is.
That is so good to know. And the American Cancer Society has reported that while the death rate from breast cancer is dropping, there's also an increase in the number of cases in women under the age of 50. Do we know why that is?
The short answer is no. Nobody knows for sure. There are some theories, including that women nowadays are more prone to obesity, less likely to be exercising, environmental factors that we're not aware of, and even an increase in genetic mutations, although that does tend to be a very low percentage of breast cancers overall. Like I said, nobody really knows for sure.
Yeah. Is there anything new when it comes to treatment of breast cancer that we're seeing?
There are incredibly exciting new technologies facing breast cancer treatment nowadays. The one that I like to tell my patients about tends to be the surgical side of things, as I am a breast cancer surgeon. I like to talk about the new technologies like robotic nipple-sparing mastectomies, which are even more minimally invasive than the surgeries we're doing right now. Some patients were able to even avoid surgery altogether, including a minimally invasive cryoablation procedure where we use liquid nitrogen to freeze the cancer rather than having to cut it out. There's also new blood tests, including circulating tumor DNA, which is called ctDNA, which can detect a cancer or a cancer recurrence in the bloodstream even before it's palpable or physically present on exam. So these are all kind of down the line, but in not even getting into all of the new chemotherapy options and treatments for cancer once it has presented.
Dr. Helseth, thank you. And who is most at risk for breast cancer? And also, other than mammograms, what can be done for prevention?
So the most at risk for mammograms tends to be women with genetic mutations. I also would caution women of color to make sure that they are getting examined by their physicians as soon and as frequently as they can. Breast cancer in that population does tend to present at a later stage and can be more challenging to treat. In terms of prevention, I always encourage my patients to be aware of their bodies. If there's new lumps or bumps that they're feeling, talk to their doctors.
Which is why those self-exams are very important as well.
Very important. And if you notice something new or different, don't hesitate to speak up and advocate for yourself. I also encourage my patients to have a healthy lifestyle and to, keep a healthy weight, exercise, cut out alcohol and tobacco.
All very important.
All very important.
Dr. Helseth, thank you so much for your time and your insight today.